Hi, my name is Lindsey and I'm a nurse with Onsite Medical, and today I'm going to go over the assessment, interventions, education, and general charting guidelines for ankle sprains. Trauma to a joint's ligaments can cause pain and disability depending on how severe the ankle sprain is. This may completely rupture, partially tear, or just simply stretch the ligaments around the ankle joint. When patients come in and they're in pain, we want to make sure that they are as comfortable as possible as soon as we can. With new ankle injuries, we like to get them in a comfortable seated position and expose the affected area. Ideally, if we're able to, we like to remove boots, socks, any additional coverings on both feet if clickable, because we like to see affected versus non-affected at the same time, so we can really gauge the patient's baseline versus how they're presenting with their injury. Next, we'd like to elevate the affected leg as well as we can with the resources available. If you were in this clinic, you could lay them down here on a bed and prop up that leg with a pillow so the leg is elevated above the line of the heart. If that's not possible, if there's able to be a chair or potentially a car that they can sit in if you're out responding to occasion, we try to get them in a seated position with the leg elevated as much as you can. We can offer over-the-counter pain medication at the start of our visit, so it can hopefully kick in and provide some comfort by the time they're done and at the end of their visit with us. We'd like to apply ice therapy, and remember it's important that we keep it on no longer than 20 minutes at a time. This is very important and should be relayed to the patient. Ice therapy will be contraindicated for patients with blisters or open wounds, hypersensitivity to the cold, or if they have any significant circulatory impairments. One thing that we like to do here in the clinic is so the ice pack isn't directly on their skin that's already hurting and in pain, is we actually wrap it either in some kind of ice pack wrap or even a spare pillowcase. Much of the subjective information gathering that we get from the patients can happen while you're setting up these comfort measures. Be sure to ask them about their perspective on their injury. What symptoms are they feeling? Symptoms that we see with ankle sprain can include pain, tenderness, and even muscle spasms. We also want to know how they occurred. What was the event leading up to the ankle sprain? Did they trip over a rock in the crosswalk and fall? Did they stumble downstairs, or was it a fall from a great height? These are crucial subjective information that we want to know. Additionally, we need to be asking if they have any relevant medical history to the area that is affected today. This can include surgeries or even if they have any baseline impairments that we need to be aware of at the start. After you get the patient's subjective information, you will move on to your objective findings, which is the measurable and observable information that we gather with our physical examination and assessment. Signs of an ankle sprain to look for include edema, limited range of motion, and ecchymosis or general discoloration. For ecchymosis or general discoloration, it's important to remember not to dismiss the severity of the sprain because ecchymosis is not present right away. It's not uncommon for a line of ecchymosis to develop at the bottom of their foot. This is just pooling that happens because gravity is pulling down the broken blood vessel drainage leakage blood from the sprain itself. It's not uncommon for some discoloration to develop as time progresses. It's always a good idea to let patients know this may be a delayed sign that develops over time to help calm any anxieties if they wake up and find some bruising. We also want to be assessing for any erythema to the area as well. It might not be full-blown bruising, but we want to make sure that we're noting if there's any bright red or faded pink discoloration to the area. We need to make sure that we note the color and intensity of the color, which is how bright the color is or how faded the color is presenting, and the size of the area of discoloration or ecchymosis. This can indicate the different stages of healing, and it's always a good idea to get a really good description at the start of their injury so again, we know how they're progressing with their follow-up care. Assessing for capillary refill and CNS changes are imperative as any significant changes from the patient's baseline may indicate the need for a higher level of care evaluation. Range of motion is measured by assessing dorsiflexion, plantar flexion, inversion, eversion, abduction, and adduction. If we're is my foot. Ankle is here, toes are here. Dorsiflexion is when the toes are pointing upward. You can also check if they have any pain with resistance. So you can place your hand on the top of their foot and ask them to dorsiflex. We can see if this increases their pain. We also measure plantar flexion, which if this is the ground, we ask them to push their toes into the ground. Inversion, if you're looking at the foot straight on, is the movement of turning the sole of the foot in. Eversion is the movement of the turning of the sole of the foot outward. Abduction is rotating the foot away from the body, and adduction is turning the foot towards the medial aspect of the body. These are all different range of motion measurements that we need to be aware of and that we're measuring at the start of their injury, so we know how to track their baseline, their injury, and hopefully the resolution of their symptoms. We also need to assess their ability to weight bear. Can they stand up and put weight on that ankle? They can partially weight bear, fully weight bear, or if they're completely non-weight bearing, we may need to consider a higher level evaluation. Some of the benefits of compression wrap with ankle sprains is that it offers a patient comfort and support while they're ambulating, but medically it helps prevent further swelling, which will help decrease the chance of pain, decrease the chance of increased injury. When to consider referring out to a higher level of care. If the patient is describing their pain as severe or debilitating or disabling, it might be time to consider higher level evaluation. If their symptoms indicate a possible fracture, which you can find out more information on under the fracture closed protocol in Trannul. Additionally, if there are any signs of sensory, neurological, or circulatory deficit, they might need a higher level evaluation. We're now going to take a moment and go over how to wrap a ankle properly. Most of our clinics and providers will be provided with some kind of compression wrap. Here we have elastic case wrap. They were in an O-limit, pick the appropriate size, and it's quite easy. They set you up for success. When you're unrolling this, you roll it, you place it down to where it rolls easily, okay? If you're rolling this way and you have to grab it and roll, you're on the wrong way and the elastic is, or the Velcro at the end is going to be on the wrong side. So when it's an ankle specifically, what I like to tell my patients, because they're going to probably rewrap this at home, is start at your toes and go towards your cart. The reason that we do this is because we want to promote proper recirculation of the blood. Because when you're wrapping, you do not need as much pressure as you think. A little bit goes a long way. You want enough to where it feels comfortable and secure, but as you're wrapping, you want to make sure that you're not going so tight, but you're actually cutting off circulation. And then I have some excess wrap, and it's okay to overlap a little bit on yourself. We wrapped it correctly, so the Velcro's on the right side. And then I like to make sure that wherever the Velcro is, I'm not coating it right on top of where the patient's pain is. If the pain was over here, I might have to either wrap a little more tightly or a little more loosely, so I make sure that Velcro is away from the area of most of their pain. A lot of the education that we give our patients is kind of as we go along. Again, the most important thing if we're doing the compression wrap is distal to proximal wrapping or toe to heart wrapping, and make sure it's not too tight. We can also educate them on the benefits of over-the-counter pain medication and when it's safe to alternate between the different drug classes available to them. We need to also remind them that for a new ankle sprain, for the first 48 hours, we're using ice only. We do not want to incorporate heat therapy from the first 48 hours. If we introduce heat therapy too early, we're actually increasing the blood flow to the area, which puts them at risk for increasing into swelling and edema, which could increase their pain and increase their risk for further injury. We don't, after the first 48 hours, I absolutely tell my patients that heat therapy is going to feel fantastic on their sprains. If we're doing ice and then heat, we always tell them 20 on, 20 off, 20 on again. This allows their skin a chance to breathe in between the two extremes, not send the skin into shock, and just make sure that they have an overall more comfortable experience with the therapies. And lastly, the patient just may want to see a doctor. If the patient requests a doctor evaluation, we first want to have that careful conversation with them and make sure there aren't any questions or concerns that we can discuss and actually answer for them, either here in the clinic or if you're responding in the field. But even after that careful conversation, if the patient still wants to be seen by a doctor, that is perfectly within their rights, and they can be sent off. Thank you so much for joining me on this educational video about ankle sprains. If you have any further questions or concerns about the ankle sprain, the severity, assessment pieces that you might be missing, any interventions or treatment that you have questions on, please feel free to reach out to your leadership. But if not, I hope you have a fantastic day and learn something with this ankle sprain video. When to refer, no, I can do it. All right, next, we'd like to elevate the affected leg as above. Okay. Next, we shouldn't have done this on shift 7. They're so chatty. Okay, are they still copying? Thank you so much. And if you have any additional questions about ankle sprains, please make sure to refer to your training ball. Can I redo the send off real quick?